guys, welcome to our channel. My name is Monica. I'm one of the surgical PAs here at Northwestern Specialist in Plastic Surgery, and I'm here with Dr. Schierle, and we are here to talk to you guys about Ellacor, which is one of the newest technologies we've brought on, and we are super excited about it. It's totally different than what's on the market, so stay tuned if you want to hear more.
Ellacor is unlike any of the other technologies that we have here at NSPS for tightening skin. Many of these devices utilize different forms of energy, heat, cold, electricity, radio frequency, lasers to resurface skin or to stimulate collagen synthesis. The Ellacor is actually using hollow bore needles with a 0.5 millimeter diameter to core out little pieces of your skin. These holes have been shown to be the right size where they do not cause any permanent scarring, but each of those little holes removes some of your skin and shrinks down as it heals. So you can actually feel confident that we are literally removing 5%, 6%, up to 8% of your skin with each passage of the treatment.
Ideal candidate is for, mild to moderate, even severe wrinkles of the skin, skin laxity. Since we are removing skin, there is a possibility of hyperpigmentation from this procedure. So the recommendation from the company only recommends treating patients who have a Fitzpatrick of 1 to 4, and also patients that do not have to take blood thinners for a long period of time. So usually it's for patients that have skin laxity from underneath this bone over here down to the jawline, that is not so severe where we do think that the patient will benefit from surgery.
So if the patient is on aggressive blood thinners, that's going to cause a lot more bleeding, bruising. That's definitely a relative contraindication. I would also say that patients that have really severe laxity, where we are concerned that they may not have the realistic expectations in terms of the ability to tighten the skin adequately, that patient may benefit from a true surgical face or neck lift. That being said, a face and neck lift does not always actually access or affect or reach these areas of the nasolabial folds and what we call the marionette lines. So a lot of our patients that have undergone previous treatments where they still have some stubborn smoker's lines or lines around the mouth, this can be a great treatment to kind of get them across the finish line and put those finishing touches on their result.
So our patients thus far that we've been performing this procedure on have given us really great feedback in terms of the procedure itself. Usually the pain scale out of 1 to 10, I would say 3 or 4 in terms of pain for the procedure. Because it is a deeper treatment and we are physically removing skin, we need to do some deeper numbing for the procedure. So, there are things that we can do in order to mitigate, pain control during the procedure. Initial feedback, so we've been performing Ellacor for how long now, would you say?
A little less than a year.
Yeah, most patients are telling us that after their first or second treatment, they are feeling much tighter. We are seeing slight improvements in terms of before and after photos. Ellacor does require several treatments because we are trying to avoid scarring, so we cannot overlap the cores, which is why it requires multiple treatments. So it takes a little bit to see final results, but we've been getting great feedback to start.
Microcoring, in distinction to microneedling, is actually removing little cores, little cylinders of tissue. And that's where the numbers of 5, 6, 8% skin removal come from. If you actually do the math and kind of calculate the area of all the little circles of tissue that are being removed compared with the area that you're treating overall, it's literally removing 8% of the tissue in that area, healing without a scar, healing with shrinkage and contraction, so that you get that really definitive skin tightening effect.
The recovery for Ellacor, you will notice some redness, some bruising, maybe a little bit of bleeding from areas that are more sensitive. So typically around the mouth, I would say there's a little bit more kind of oozing from that area. You're going to see little boxes of where, the cores were removed. That throughout the treatment area can last for up to 30 days. It depends on the person. I would say most commonly you're going to see those boxes for 2 weeks at least. And then afterwards, I would say pain is very minimal. There are specific instructions that we will discuss with you about taking care of the skin after Ellacor, so we can discuss that more the day of your procedure.
All right, so hopefully that answers some of your questions about Ellacor. If there are any others that you thought of, please feel free to leave them in the comments below. Otherwise, thanks for watching, and we'll see you next time.